Therapeutic phlebotomy is the cornerstone, frontline, most important element of hemochromatosis treatment. In hemochromatosis, therapeutic phlebotomy is a procedure that removes blood from a person's body with the specific goal of reducing iron overload. In this video, my goal is to give you the most comprehensive overview there is of phlebotomy and, most importantly, how it can help you in your journey with hemochromatosis. Plus, I will give you my top 7 tips for how to best handle this supremely important but often challenging treatment, so be sure to stay around. Hello and welcome. I am Dr. Eric Lewis, a naturopathic doctor personally impacted by hereditary hemochromatosis. My unique perspective as both a healthcare provider and as a patient with high iron may bring clarity and understanding to your own healthcare needs. Therapeutic phlebotomy involves the same procedure as blood donation. The primary difference is how often we give blood. Phlebotomy, which is also known as venesection, may be recommended quite frequently for a person who has just been diagnosed with iron overload, especially if their ferritin levels are significantly elevated. A physician's prescription is necessary when the recommendation for phlebotomy is more frequent than the typical time frame allowed between a routine blood donation at a community blood services center, which is allowed to be completed only once every 56 days. Therapeutic phlebotomy is continued until a patient's ferritin level reaches a goal level set by their physician. Most experts state that each phlebotomy reduces the ferritin by 30 to 50 points. Now, some patients report to me an even greater reduction in their ferritin for each phlebotomy, especially when they are first beginning treatment and their levels may be very high. When a person's ultimate goal level of ferritin is accomplished, there is much to celebrate. However, in looking forward to the future, a person will want to prevent their iron levels from becoming elevated again. Maintaining a healthy iron and ferritin level becomes the next therapeutic goal. What is a phlebotomy procedure and how does it work? The process involves a trained phlebotomist inserting a needle into a vein to collect blood. Most likely, one of the large veins that pass close to the skin near your elbow crease will be selected. A large area is cleaned with an antiseptic. It is a very clean and a very safe process, and every step is taken to ensure your comfort throughout. Therapeutic phlebotomy involves a technician removing approximately 450 to 500 milliliters, or 1 pint, of blood. Now, depending on your height and weight, your circulatory system holds about 10 to 12 pints of blood at any given time. So removing 1 pint of blood is a significant amount. Now, phlebotomy is trying to accomplish 2 things. One is immediate, and the second is long-term. Hemoglobin in your blood carries iron, so when you lose blood via phlebotomy, you're also removing iron. The short-term benefit is that on average, 1 donation removes 250 milligrams of iron, which is a very significant amount. Considering the typical daily loss of iron through our general metabolism is only about 1 to 2 milligrams, a single phlebotomy can be a very powerful tool to reduce iron overload. However, that's not the only benefit to phlebotomy. There is a long-term benefit as well. When the body's blood level is reduced, it sets off an alert to create new red blood cells. Our brain doesn't know why we just lost so much blood, so it sends a message to the blood-creating processes of the body to get to work. The kidneys detect that the blood levels are low, and it sends a signal to the liver, spleen, and bone marrow to coordinate and produce new red blood cells. What's the key ingredient in red blood cells? Hemoglobin. And what's the key mineral required for hemoglobin to work? Iron. So where's the body going to get all that extra iron on such short notice? Well, from the storage sheds of iron located in our ferritin. And what happens if the body pulls out a lot of iron out of storage to create new red blood cells? The overall level of ferritin goes down. Amazing, right? The organs become less overloaded with iron because phlebotomy has naturally tricked the body to use the iron instead of to store it. It's both the short and the long-term benefits of phlebotomy that make this such an important tool for iron overload. How long does phlebotomy take? When there are no complications, therapeutic phlebotomy usually takes about 10 to 15 minutes to complete. It can be quick and easy for many individuals, whereas for others it may take around a half an hour or more. On the other hand, I've had people tell me that their phlebotomist will have a difficult time finding a good vein, which may add to the time involved, and not to mention the discomfort level as well. One person told me that her phlebotomist uses an ultrasound machine to find a vein, and the process takes over an hour. Her situation is a worst case scenario and is atypical. How often will I need a therapeutic phlebotomy? The frequency of how often you have therapeutic phlebotomy depends on your physician's recommendations. This prescription accounts for several factors, including the following. Lab tests. What is your degree of iron overload? Your ferritin level or your iron saturation percentage? What is your hemochromatosis genotype? How significant are your symptoms related to iron overload? Do you have any other healthcare conditions? And also, how is your ability to donate blood? Even though phlebotomy is safe and effective, some individuals have a difficult time. Now, perhaps they have low blood volume and are subject to fainting. Perhaps their veins collapse. Perhaps they have had so many therapeutic phlebotomies that their veins have developed a little scar tissue in them. Now, some folks just plain old don't like it. I have heard all of these stories and more from individuals suffering from hemochromatosis. It can be very hard. Believe me, I know. What are the side effects of therapeutic phlebotomy? Individuals with the highest levels of iron overload may undergo phlebotomy weekly until their iron numbers improve. As important as it may be for your health, phlebotomy can be hard on the body. It can be challenging to be sure, especially when you do it with a high frequency. Now, of course, it may save your life. Besides iron chelating medicine, which have their own pros and cons and frankly aren't frequently prescribed, phlebotomy is really the only conventional medical treatment out there to get excess iron out of your body. During the procedure or right after, low blood pressure can occur, and this may lead to feeling lightheaded, weak, or even fainting. Bruising can occur, and some symptoms can persist beyond the treatment. Now, once upon a time, the goal of therapeutic phlebotomy was actually to induce a mild state of anemia in an attempt to clear the stored iron from the tissues and organs. But technically speaking, anemia refers to how much blood you have. It is not specifically about how much iron you have. Quite a number of individuals have reported to me that they begin to feel anemic if they give blood too frequently. And I would actually say that this is the most common concern about phlebotomy that people with hemochromatosis tell me. Fortunately, the practice of intentionally maintaining an anemic state for reducing iron is no longer advocated for hemochromatosis patients. Even though it seems contradictory, it is possible to have too much iron and simultaneously be anemic. If too many phlebotomies are performed too quickly, it is quite possible to become anemic during this process. Trust me, as someone who has been anemic due to phlebotomy, I know how weak, dizzy, and poor you can feel. So please, if you have any concerns related to your response to phlebotomy, contact your doctor. Ask questions and raise your concerns. This is your healthcare we are talking about. As important as it is to get that excess iron out, you should not have to feel terrible during the process. It is often a difficult balance to achieve, yet it is essential to try and find that right frequency and amount. If you are having challenges with phlebotomy, what are your options? Number 1, slow down. Number 2, reduce iron from the source with diet and natural remedies. And number 3, take steps to make the experience less unpleasant. Sometimes the answer is straightforward. Slow down. Take it easy. Instead of every 2 weeks, see if your doctor will shift your schedule to every month. Instead of every month, maybe every 2 months. Treat the process of de-ironing as a marathon, not as a sprint. Doctors may even prescribe half of a therapeutic phlebotomy. This is where the amount taken is half the normal amount and might be easier for you to do if the full phlebotomy is too difficult for you. Ask your doctor if this is something they may be willing to do for you. Some phlebotomy may be better than no phlebotomy. Figuring out ways to make it work better for you, even if it's not the ideal schedule as originally set out by your doctor, may be better than not being able to do it at all. The next option is to reduce iron from the source with diet and natural remedies. This strategy focuses on lowering iron via nutritional means so that there's less overall iron to have to remove. If you would love to learn more about dietary and supplemental approaches to managing hemochromatosis, be sure to check out all of our resources on our website, hemochromatosis.help.com. Lowering iron with diet and natural remedies is our expertise. So after you finish this video, be sure to check out the links in the description box below. Finally, you may wish to take steps to make the overall experience less unpleasant. I've spoken with so many people who really don't like phlebotomy and they really struggle with it. But because it's important, you do it anyways. So anything that can be done to help make it just slightly better can help you stick with this very important therapy. With this in mind, here are our top 7 tips on how to feel your best with phlebotomy. Number 1, keep hydrated. Before phlebotomy, be sure to drink more water to get the overall volume up in your bloodstream. Hydrating also helps to make the blood vessels just a little bit bigger, so it's just a little bit easier for the phlebotomist to access your vein. Finally, continue to hydrate afterwards to replenish the fluid that's been lost. Number 2, replace lost salt. Whereas the advice to stay hydrated may be something you've heard before, you may not have been told that you lose a tremendous amount of salt with every phlebotomy. The top mineral removed during phlebotomy is, of course, iron. But did you know that the second and third most common minerals removed are sodium and chloride, aka salt? One strategy that may make sense is to eat a salty snack or a meal after your phlebotomy to help replace what was lost. I've had a number of people report that this helps them feel better. Now, of course, please check with your doctor, especially if you have high blood pressure or if you've been instructed to eat a low salt diet. Number 4, replace vitamins, minerals, and other nutrients. Electrolytes like magnesium and potassium, as well as B vitamins and zinc, are also lost during phlebotomy. Make sure to eat nutrient-dense, healthy foods before and after to help replace all the good stuff you lose. Some people even find a sports recovery drink or electrolyte drink to be beneficial. Number 5, rest and take it easy. If at all possible, schedule your phlebotomy so that you can take it easy the rest of the day and maybe even the next day. This is one thing that has worked for many of the people I've talked to who struggle with phlebotomy. Having that time already set aside so that you can rest and recover is a great strategy. Number 6, hot and cold compresses. If you bruise easily or find the sight of the needle stick painful, you might find cold compresses or alternating hot and cold compresses to provide relief. Number 7, combating needle phobia and anxiety. Any stress reduction technique can be helpful here. You can try deep breaths, visualization techniques, meditation, or prayer. The less stressful the experience of phlebotomy can be, and the better you can feel afterwards, the more likely you are to follow through with it the next time. Everyone has their own unique journey, so find what works best for you. How do I get a therapeutic phlebotomy? Here are my suggestions for how to receive therapeutic phlebotomy. Number 1, ask your physician, if you haven't already, of course. Your doctor will have often already written you a prescription for phlebotomy and instructed you how to proceed. Number 2, search the following list for centers that have applied for a variance by the FDA for collection of blood from individuals with hemochromatosis. I will have a link to this list in the description box below, and you can also find it on our website's page on therapeutic phlebotomy at hemochromatosis.help.com. Now, do note this link is from an archive. As of February 2021, this link no longer appears live on the FDA website. However, we still have the information available for you on our website. The most notable change since this list was last updated is that as of August 1st, 2022, the American Red Cross now accepts donations from hereditary hemochromatosis patients. This had been a major limitation previously, but fortunately we may now be able to utilize the Red Cross. Number 3, search for your state on this comprehensive list of blood service centers in the United States. In alphabetical order, here are the blood donation agencies in the United States. Now note, not all of these have the FDA variants. Call your regional center to see if they will allow you to use their phlebotomy services. Bottom line benefits of therapeutic phlebotomy. Phlebotomy helps you lower ferritin and may reduce the symptoms of too much iron. On top of that, your donation may help save another person's life if drawn by a center that can use the blood for others. There's no single better way to help in the treatment of hemochromatosis than therapeutic phlebotomy. I know I feel much better. I will audibly exhale a sigh of relief about 2 or 3 minutes into a blood donation. My muscles and joints hurt less, sleep better, and I'm less tired, and my thoughts are clearer. Many people have reported similar improvements in how they feel. And there's no doubt the positive impact that phlebotomy has on our lab test numbers, including ferritin and iron saturation percentage. Therapeutic phlebotomy absolutely saves lives from iron overload, and I consider it an essential part of hemochromatosis treatment. And remember, whatever you do, always give 100%, unless you're donating blood. Now, we know hemochromatosis can be scary, lonely, and intimidating. We've also realized that there is a lack of clear information out there to help empower people with iron overload to take charge and learn how to live a healthier life with hemochromatosis. Diet and nutrition for lowering iron is our specialty here at Hemochromatosis Help, and these healthy lifestyle habits can perfectly complement the benefits of therapeutic phlebotomy. That's why our aim is to help you learn the safest and most effective diet and supplement strategies to help support you or your loved one's health. We'll show you the clinically researched nutrients and supplements that may synergize with phlebotomy to help lower elevated iron levels safely. We place a strong emphasis on iron-related nutritional information on our website, hemochromatosis.help.com. So allow us to guide you in your journey to understanding iron overload and feeling your best. While you are there on our site, be sure to sign up for our free newsletter, where we share our very best recommendations on food and nutrition for reducing high iron. And if you really want to take your understanding of the best diet for hemochromatosis to the next level, my wife and I have both written the most comprehensive, helpful, yet easy to understand books on diet and cooking for hemochromatosis. Thanks so much for watching, and I hope you have a great day. See you in the next video.